A beginner's guide in understanding and protecting yourself from the novel coronavirus COVID-19. Experts explain what you should do to get ready, how to protect yourself, what researchers believe are the likely scenarios going forward, and the latest fact-checked news. Always use caution with what you listen to online, particularly in situations like this. You can trust this video because it's researched by actual emergency experts with decades of relevant experience, and we are working directly with sources inside various government agencies and thus forth. Your most important goals. Be able to shelter in your home for at least 2 weeks. 90 days is even better without leaving for supplies or outside help. If we have a significant amount of transactions here and transmissions here in the US, you'll want the option of avoiding other people and public places. Or, if things get really dire, it may be recommended or required that you stay in your home for a period of time. Be able to protect yourself from picking up the virus. There are steps you can take now, and more serious steps you may want to have ready in case things get much worse. Listen to legitimate news sources so you can make your decisions based on accurate, rational news. This epidemic already has actual cause for concern. There's no need to make things worse with fake news. If you're really totally unprepared, get the following absolute essentials before taking any other steps. 1. A source of potable water. Storage is preferable, but if space is tight, then get a filter. 2. Extras of any essential medications you're taking. 3. Toilet paper, feminine hygiene products, soap, detergent, and everything else you need to keep your body and your home safe and clean. 4. An N95 mask and nitrile gloves. What to buy to protect yourself against the coronavirus? When it comes to stocking up on protective gear and medical products, the idea is not to recreate a full-blown emergency room or ICU. Rather, you want to have enough of an ability to take care of minor medical situations at home that you don't have to run out to a doctor's office or pharmacy unless it's a serious medical emergency. You should also prepare for medicine shortages because not only will supply chains and factories be disrupted, but the demand for medications from the overloaded healthcare system will be so high that you may have a hard time getting any common over-the-counter medications and prescription drugs. These are your goals. Try to get a month's supply of your prescription medications. Stock up on commonly used medications, example, pain relievers, cough suppressants, antibiotic, ointments, creams, and the like. Prepare for the inevitable stomach problems that will arise from eating your shelter-in-place food by buying Imodium AD and similar products. Prepare for the possibility that you may need to quarantine a sick friend or family member inside your home. Be able to clean and disinfect the space where you and possible multiple others will be living for an extended period. The bare essentials: nitrile gloves, hand sanitizers, eye protection such as industrial safety goggles, swim goggles, or anything that will keep someone else's sneeze from hitting your eyes. Even basic glasses are better than nothing. Toilet paper and feminine hygiene products. This stuff turned into currency on Hong Kong during their lockdown, since so people thought to stockpile up on it. Bleach, alcohol, and other household cleaners that will kill viruses on shared surfaces. A word about respirators. You would want to get a respirator rated N95 or above, example P100. Surgical masks. The common types found at corner stores that are more commonly worn in Asia are not proper respirators. They are mostly designed to protect other people from you, not the other way around. However, proper respirators are in low supply around the world right now. 3M is running their factory 24/7 just to meet urgent medical needs. If the best you can do is a surgical mask, it's better than nothing actually. Respirators, filters, cartridges don't last as long as most people think. so buy as many as you reasonably can. A full face respirator, that is a gas mask, protects your eyes, nose, and mouth at the same time. If you buy disposable or half-face respirators, you'll also want separate eye protection. Fit is important. A respirator needs to have a tight seal around your face in order to stop bad particles from getting inside, which means those with facial hair or children with small faces need to be extra careful since there isn't a proper seal around their faces. What to buy for the other challenges of an outbreak? Note that even under the most severe scenarios experts currently envision within the US, utilities and local government services will still function. So for now, what you're mostly focused on is being able to comfortably survive locked inside your house for a few weeks. This means you'll need food, water, and things to keep you occupied during a lockdown. You might also have not much warning before the moment comes, but you'll need to stay in your home for days or weeks. Don't assume you'll have time to run to the store or that the supplies you will want will still be on the store shelves. Food and water. Here are your goals. Have ready access to enough potable water for at least 72 hours. That is 3 gallons at 1 gallon per person per day. It's very unlikely the tap water will run out, but water is so critical that you never want to risk going without it. Ideally, you need at least 15 gallons per person. That is enough for 5 days. Cover the basic nutritional values. Have enough carbohydrates, protein, fat, fiber, vitamins, and minerals. Stock up slowly by grabbing extra every time you go out. Prefer foods you already eat so as to avoid the gastrointestinal problems that come with disruption to your diet. Prefer shelf-stable foods that don't require to be in the refrigerator. Get some comfort foods such as candy, desserts, snacks, baked goods to help with the stress of a crisis and a change in your regular routine. Mix staples that require stovetop preparation, that is rice, pasta, beans, with ready-to-eat meals, example canned goods and MREs, because you may also want to be in a position to prepare food due to illness or lack of time. Water is so important that we include it here as a requirement despite our starting assumption that the taps will run out throughout a pandemic. It may not be feasible to store multiple weeks worth of water, but you should have at least 72 hours worth, which is 3 gallons per person on hand in case of a temporary disruption of your water supply. Here are the best practices. How to keep from getting infected. Stay away from other people. That is social distances, which is the best way to avoid getting sick. Wash your hands regularly. Don't shake hands with other people. It's a gross custom that needs to end anyways. Be aware of how often you touch your face and try to break that habit right now. Don't forget that your eyes are as much of a front door for the virus as your mouth and nose. If you venture outside using gloves, respirators, and/or goggles, wash your hands before removing protective gear. Then be careful of what you're touching as you remove the items. SARS workers were getting sick just from short moment when they removed their gear and dirty parts, fingers touch places that they shouldn't have. What should you do if you get infected? Isolate yourself and warn family members. If you haven't traveled in the last week or two and there aren't known coronavirus cases in your area already, it's likely you have the normal flu. Call your doctor. If you go to a hospital or other healthcare facilities, wear your protective gear and don't take it off unless a professional tells you to. If you don't have proper protective gear, use anything possible, such as a bandana or a t-shirt over your mouth and nose while wearing sunglasses and winter gloves. Please check our video description below for other instructions on how to keep yourself safe.